Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight we're going to talk about general medical screenings that you may not be aware of. Also, do your joints hurt? Do you have back pain? Do you hurt all over? We've got a pain specialist to talk about. We're also going to learn about Chalk the Walk for suicide prevention and addiction medicine. All that and how faith can affect your health care. My first guest tonight to start us off is Dr. Susan Monohan, who is an internal medicine and pediatric physician with Family Practice Associates. Welcome.
Thank you for having me tonight.
Now, we talked about general screenings, things they might not be aware of. Most of us know about colonoscopies and mammograms. And the ones we're going to talk about here, they may not always be specific to that individual. They need to see their family doctor to see if it's right for them. We're going to give them some general guidance, but it's individualized as to what may be needed.
Yes, as a primary care doctor, we really do like to emphasize preventative care, and so it's great to get to talk about that. But again, there are sometimes conflicts or variations in recommendations, so definitely talk to your doctor to see what screening might be right for you.
Well, let's start with some that we don't normally talk about, osteoporosis and bone densities. What is osteoporosis and why do we do that screening?
So osteoporosis is specifically when the bones start to get thinner. When they get thinner, it puts you at higher risk of a fracture, and that can be very significant. So if you fall, then instead of it just being a tumble, it may actually be a serious fracture or surgery or impairment of mobility. So the reason we love doing the bone densities is we're able to maybe identify people who may have precursor, which is osteopenia, and may be able to approach some things to try to prevent even getting to osteoporosis.
Now, mostly that's with menopausal women, but sometimes men?
So yes, in this particular case, females are usually who we are most concerned about with osteoporosis. There are occasionally where men do need screening, and I would say that's a definite talk to your provider about. But for women, it is usually postmenopausal, where that because you lose estrogen, your bones are at higher risk of becoming thinner. And
family history and all these screens we're talking about is important in terms of getting them done.
Absolutely, absolutely.
Now let's talk about another one here. It's lung cancer screening. What do they do?
So we're very fortunate that we have more availability as far as lung cancer screening, and specifically that test is a low-dose CT, and it's done specifically to screen for lung cancer. It's generally people who are active smokers or who have quit smoking within depending on your insurance, about 15 years, and you have to have so many years of smoking pack years, but the goal is to try to identify people who have lesions that could turn into cancer, catch those quicker where there's intervention that's capable versus when they actually develop true symptoms from lung cancer.
So if you're a smoker, get your lungs scanned, but don't be a smoker to start with.
Absolutely.
Okay.
Not smoking is the best prevention, obviously.
Now, smoking also can lead to an increase in abdominal aortic aneurysm. So tell us what that is and what the screening method is for that.
Well, and that again it's a wonderful thing because the screening is doing an ultrasound, and basically, again, it's not painful. Now, this is one of the screenings that men is usually the people we're looking at screening versus women. Now, we will screen depending on family history. Smoking is a big risk factor. Hypertension also is an age or the other things that we're looking at as well.
What is an aneurysm? Why worry about it? What happens?
Well, particularly we're talking about the abdominal aorta is what we're screening for. And an aneurysm is where that vessel can eventually rupture. So if it's getting larger, a ruptured abdominal aneurysm can be most likely fatal. Yeah. And so you want to identify people who are at risk so that intervention can be done or they can be monitored appropriately.
Okay, how about something simple like cholesterol and blood pressure?
So, that's the one thing that is easy to do and something we really should start pretty early on. There's variation of ages, but it's not bad, for you know, a young college student or somebody in their 20s or 30s to even start, when they come into the doctor, they should have their blood pressure checked, even if they have a sore throat. And then every few years, they should have their cholesterol checked.
Diabetes also, glucose?
Diabetes, a lot of times we will screen for, particularly obesity or even overweight. That puts you at higher risk of developing diabetes. So those are, and family history is the other one we would say we'll add those on to screening.
All right, real quickly, pap smears.
Okay, pap smears is one of those things that's changed from years and years ago, where everybody had a pap smear every year. We don't do them as often, but we do them more meaningfully, meaning that a lot of times we'll do co-testing for HPV, which is the human papillomavirus. And so, but everybody, we do recommend keeping up with those, but the doctor's recommendations might not be the same as what you had seen 20 years ago.
Okay, that's great information. We appreciate you coming in and talking all about it for us. And if you haven't had your screenings, including the things we've talked about and mammogram and colonoscopy, you ought to get them done. We'll be right back.